Good afternoon, everybody. I'm Dee Dee Grubbs. For those of you that don't know me, the Association Coordinator for Montana Pharmacy Association. I'd like to introduce Young Huff with Big Sky Care Connect, and she's going to go over what Big Sky Care Connect is and how it works, and maybe you guys could give it a try and see if it'll work for you. So I'm going to turn it over to you, Young.
Thank you, Dee Dee.
Yep.
All right. Well, on behalf of Big Sky Care Connect, I'd like to thank Montana Pharmacy Association for their support of the Montana statewide HIE. And special thanks to Dee Dee for all of her assistance in giving us this opportunity to talk to all of you today. As she mentioned, my name is Young Huff, and I'm one of the Partner Success Managers at BSCC. I also have with me one of my colleagues, Becky, who's here and who'll keep an eye on the chat box. So if you have questions come up along the way, feel free to interrupt me just by unmuting or putting it in the chat box. So this is kind of what we have on the agenda today. I thought I'd share with you kind of an overview of BSCC, the value it can bring to pharmacists, talk a little bit about privacy security and who our current participants are and kind of what we're working on next. And then I'll show you a quick live demo of our HIE so you can kind of get a feel for what the provider portal is like. And then we'll go over a quick overview of the onboarding process. Then we can open up for questions and discussions. Any questions on the agenda before we get started? All right, sounds like none, so we'll go ahead. So in case you have not heard about BSCC, I wanted to give you a quick introduction. We were established in 2018 as a nonprofit organization to establish and operate Montana statewide HIE, and it was endorsed by former Governor Bullock. We have board of directors with diverse representation made up of high-level decision makers from all types of Montana healthcare organizations, and it includes representation for providers, patients, payers, and businesses. And we also have an advisory committee structure with input from experts in the field advising the board. We partner with InterSystems, who is a global leader in the field of interoperability, and they actually won the Best in Class award for interoperability platforms last year. So what is an HIE? Well, an electronic health information exchange is a modern solution for modern healthcare, which allows doctors, nurses, pharmacists, and other healthcare providers to appropriately access and securely share patients' vital medical information electronically, thus improving efficiency, quality, safety, and cost of patient care. We connect entire care continuum, allowing more of an interdisciplinary and patient-centric approach to healthcare. It really allows you to access the information you need at the point of care. So how can pharmacists benefit from connecting to the statewide HIE? Well, this can help improve transition care through our event notifications and access discharge summaries. We can also enhance medication therapy management sessions by providing access to comprehensive medication history, diagnosis lists, and lab results. I'm a physical therapist by trade, and I'm not a pharmacist, so I thought it would be helpful for you to kind of hear from someone who's a pharmacist who has used a statewide HIE. So I had the opportunity to reach out to someone who worked with the HIE in New York. And she kind of summed it out by saying that it was painless, but very educational. So here's what she had to say. She said that having HIE information prior to dispensing so that she could have the best picture of the patient's medication information was very valuable. The information can be used to monitor opioid misuse and doctor shopping. Pharmacists can also see non-opioid medication use and monitor for lack of adherence or even misuse of those medications. And she said, you know, you'd be surprised how many people don't know how to use medications like thyroid medications properly. So having discharge information, pharmacists can also use this to clarify treatment regimens. They can look for treatment gaps around testing like A1C for diabetes and immunizations. Lab values are also helpful as pharmacists look to monitor anticoagulant use as well as triaging the need for additional supplementation where one medication depletes vitamin and mineral levels. So hopefully that can kind of give you an idea of the use cases for pharmacists for HIEs. Any questions before we kind of move into privacy, security, and talking about the technology? Okay. Well, we have a very secure system that is TEFCA compliant to follow ONC standards and high trust certified to demonstrate compliance with HIPAA standards. Our data is encrypted at rest and in transit, and users are granted access according to their roles, and all activities in the system are logged and auditable. So we were really excited back in December of 2020 to have our system go live. We use InterSystems HealthShare HIE platform. So we built the foundation that provides the integration tools and privacy and security measures. And now we're working diligently to bring in the data from all of our signed participants that are hospitals and clinics and different types of clinics. So we currently have 15 hospitals, as well as one FQHC with 6 sites, as well as 7 pharmacies contributing data directly into our HIE. And our data is growing on a weekly basis. We also have, well, this includes ADT data, which includes demographics, allergies, diagnoses, procedures, and encounters. And we also have radiology and lab results coming in from some of the hospitals. We partner with Dr. First for medication history, and they have a nationwide network to bring us the medication information. So there's 3 different ways you can access the HIE. The first is a single sign-on, which makes it easy for providers to access patient information right from the provider's EMR. And this feature kind of automatically signs the user into the HIE, finds the right patient record, and opens it all in one click, which means you don't have to remember another login and password. Another way that we can give you access is through direct query, where a provider can pull a continuity of care document right into their EMR. And third way is through our provider portal, just a web access. Right, here's a list of all of our signed participants. We have a total of 83, but that equates to over 200 sites, because a lot of our hospitals and health systems have various sites that are included in that participation. So there's 38 hospitals, 18 primary care or specialty clinics, 8 long-term care, skilled nursing facilities, 5 behavioral health agencies, 9 pharmacies, 2 emergency management systems, and 2 state federal agency and 1 payer that have signed up. So what's next for BSCC? Well, we're really busy onboarding all of the participants that have signed up, so we'll have more data coming into our system. In the near future, we're excited to have 3 years worth of patient data coming in from Medicaid. That includes medications, diagnoses, from 700,000 patient records. We've also partnered with eHealth Exchange, and they're a national database network, and they have connections and partnerships throughout the nation with all of the HIEs and regional and statewide. So this is allowing us to do direct connection with our bordering states. So we're currently working on that actively to connect with Wyoming, Idaho, North Dakota, South Dakota, Utah, and Colorado. We're also in the queue for accessing the VA and DOD information as well. So looking forward to getting that data. So as we continue to work on additional participants go live, the volume and the richness of the BSCC record will continue to grow. We're also working on patient event notifications. This is a feature that will allow real-time notification for ED and hospital admissions, discharges, and transfers for patients to those who subscribe to this function. And then we've also partnered with Health Catalyst for data analytics and quality metric solutions that we are currently working on, that implementation. So more on that soon. Well, that's what I had to share before I show you the demo. Any questions so far?
I guess I had to skip away for 30 seconds or so, but
Okay.
I was looking at the fact that you have some pharmacies signed up, and I wonder if you could sort of elaborate on what sort of activities are occurring with those. I think they're community pharmacies like Western Drug. What sort of activities are they engaged in now? Do you have any input there for me?
Yeah, so most of our pharmacists sign up to access the information that's available in the system that's
Mhm.
relevant to them. So for an independent pharmacy in a small community, the local hospital, if they've signed up and they're contributing data, they can go into the HIE to access most up-to-date information coming in to the portal from that hospital or any other primary care clinics that they work with. So it's primarily for access, but also on the other side, they have the option to contribute data as well. As I mentioned, we work with Dr. First, who is our partner, and they have a more varied partnership across the nation with claims data and independent pharmacies and hospitals. And they also work with all of the pharmacy software vendors. And they have already set up contractual relationships with them and have interfaces going with them. So if, for instance, an independent pharmacy Montana joins BSCC and they would like to contribute their data, and let's say that their EMR vendor already has a partnership with, not the EMR, it's the pharmacy vendor, it already has a partnership with Dr. First, they can just provide consent and flip the switch, and their data will flow in to the HIE through our relationship with Dr. First. So it just grows that data that's and make it more robust in the HIE. Does that
So
make
if I
sense?
can interrupt for a second, I can give you an example of why we used it. We
Perfect.
had a patient come in for his second COVID vaccination, and he reported to us that he had a stroke after his first one. We could not get a hold of the providers. He was seen at two different facilities. And so we ended up going on to Big Sky Care Connect and looking at the history that was reported and determining whether or not he could receive that second dose. We ended actually calling one of his physicians and getting the physician to tell us that he wanted him to have the second dose because we felt it was a risk if he actually had a stroke after the first one. We didn't want to give him a second dose and have him have a more catastrophic result. So that's how we used it. That's actually the first time that we've used it. And I thought it went very well.
Awesome. Thank you so much, Dominique, for sharing that.
Thanks.
It's a great use case.
Thank you.
Does that answer your question, James?
It does. Thank you so much.
All right, Luke?
This is Luke with Blue Cross Blue Shield of Montana. I'm just kind of curious of the pharmacy information that's coming in, pharmacy claims from a pharmacy benefit. You know, if that's coming in and from who, who do you get that from? Pharmacy, you kind of mentioned it. Pharmacies could come from the PBM, could be coming from the carrier. And if you are getting in, how are you preventing duplicative type entries, I guess, because it could come from many sources.
Yeah, so Dr. First has a connection with SureScripts. So anything that's contributed to SureScripts is already coming into our network through that relationship and partnership with Dr. First. And then, as I mentioned, it's not just SureScripts, they also have those connections with various claims data and independent pharmacies and hospitals. So whatever they have in their network, we are able to get access to in our system. It's not 100%, of pharmacy data yet for Montana. And that's why we're also working with them to reach out to some of these independent pharmacies that may not be contributing their data yet to make it more robust. And when I go into the live demo, I'll be able to show you. So our data it shows you longitudinal data, and it's also aggregated to kind of take out the duplicates. So you'll kind of see and get a bit of an idea when I show you the demo, what the medication feed looks like. And that might answer that question a little bit better for you.
Yeah, sorry, I'm also a little behind, so I'm Googling on the internet. Dr. First is what, electronic prescribing software? I'm familiar with SureScripts. Are they together in some way, or are they kind of separate?
Yeah,
entities?
they're a separate company, but a lot of the SureScripts, I think a lot of the hospitals and pharmacists use them for electronic prescribing as well.
Oh, so there are two electronic prescribing platforms
I think
that are providers. That would make sense.
So.
Okay,
can
thanks.
you guys verify? Yeah, I don't know if Dominique, you can speak to that. You probably know better about that than I do, but I think so. Yeah. Any other questions before I go to the live demo? Can everybody see my login screen now?
Yes.
Okay, perfect.
Yep.
So I'll be giving this demo in the BSCC production environment, but we have a dummy patient linked to a dummy training facility. So no real data will be displayed during this demonstration. So I'm just going to use my login and password. This is pretty much what pharmacists would be doing once they get access. So when I first log into Big Sky Care Connect, we land on the patient search screen. Patient search allows the users to find patients in two different ways, either using an MRN and the associated facility or by patient name. When you search by patient name, you can usually enter the additional demographic information such as birth date and address to kind of narrow down your search. I'm going to do it by medical record number and facility. So it's a training facility. So when I enter search here, patient search results screen is going to display my results. And because I searched by MRN, I got an exact match with a weighted match score of 1,000. Now, if I had searched on a patient name, I might get a list of potential matches with weighted match score much less than 1,000. So if I select on this arrow here, to the left of the patient's name, I see additional information about that patient and the MRN associated with the patient, as well as the different data types that's available in the HIE for the patient. If I click on any of these icons, you get a legend with a list of data associated with that record. So for David, we see that I'm going to get allergy, lab results, encounters, demographics, diagnosis, and medications. So in order to go into his record, I just click on his name here. When I get into this page, you can see these icons on the top right corner of the page. And by clicking on those, I can see some important information about David. Looks like he's got allergies. So if I click on that, you can see that he's allergic to eggs and radio contrast dye. There's also demographic information. It's kind of a shortcut to the demographic. So if I click on that, I'm able to see demographic information, address, phone number, marital status. There's also a link to seeing all of the MRNs associated with that patient, as well as emergency contact here. Okay. Let me go back to the chart book. All right, so when you come to this page, it provides you with a clinical summary. And this is designed to kind of give you a quick view with 5 different sections here. Well, 6 sections. It gives you kind of the 5 most recent entries for diagnosis, lab results, allergies, diagnostics, medications, and documents. Now, if I collapse this clinical summary right here, I see all the sections available in the BSCC patient record for this patient. If you see a blue bar displayed to the left of the section, that means that there is data available for that section. So each individual section kind of behaves in similar ways. So I'm going to go into encounters first, kind of show you how you can use the search function here. So let's say I have a really long list of different encounters and I'm just concentrating on looking at inpatient. So I could put just inpatient right here, and that will bring up just the inpatient encounters. If you want further details, we have insurance information right here associated with each of those encounters that you can look at. Okay. I'm going to go into medication data now to kind of show you a little bit of how the sort function works. So you can see a list of medication history here. If I go in here and do a primary sort for medication and then do a secondary sort for date, you can kind of get a good idea of what this patient's refill patterns are for certain drugs like sertraline. I hope I'm saying that right. Now, if you wanted to see any of the details associated with any of the medications here, you would just click on the details ellipsis here. And it will show you duration, number of refills, as well as the SIGN information here and the ordering provider. Any questions on that? Okay. Let me go back to the chart book. So pretty easy to navigate and simple to use. I'll show you our diagnostic studies. It will list all the studies that this patient has had done. And if you want more details on each of those studies, you just click on the report and it will bring you all the details about that, as well as the results of the study embedded right into that. And you can read the whole summary right here. And then let's take a look at lab results here. If you go into lab, the first section is organized by the lab tests with individual test results displayed along the right of each test. Most recent test displayed first. So if you click on one of these results, it'll display the full details. And from the result details screen, you can click on cumulative to see the full history of results for that test. And as you can see, they have in red the ranges that are abnormal. And I can go back into the chart book. And if there's more than one result, you're going to see this little C, the column. So if this displays the same cumulative history that we just reviewed, but you can also do a graph and get a good look at the trend. So here are the dates that are displayed. I can pick and choose the different types of tests. So let's take a look at calcium, glucose, and albumin. I can go down here and do a refresh graph, and it will give you a nice trend graph of the results for those three that I selected. So kind of a nice little feature. And then the last section I'm going to show you is patient summary report. So up here in the ellipsis, you can do click on the access summary. And you can see that you have the ability to generate a report with all of the data that's in the HIE for this patient. So it starts out with a format in HTML, but you have the option to choose either CCD format or a PDF. PDF, I think it looks cleaner, so I'm going to choose that. And if you subscribe to our direct secure messaging, which comes with your subscription to the HIE, you have some additional features included. So if you don't know about direct secure messaging, it's kind of like an email feature, but it's very secure and it's made for healthcare use. So you're able to share PHI with other professionals with direct secure messaging accounts securely and safely. So we have access to the national database of all the providers with direct secure messaging addresses. So you can access that right here. So I'm going to actually search for one of my colleagues that I know has a direct secure messaging address and see if she comes up. Oh, there she is. So she works for both Big Sky Care Connect in Montana as well as North Dakota HIE. So I'm going to click on the Big Sky Care Connect one and it populates her address automatically there. Now you can preview what you want to send them by clicking on the preview here. And that'll bring up whatever format you have chosen for that. Now, if you wanted to filter that information and only send some of the information, you have the ability to do that as well. So if you go in here, you can say, okay, I want all of the demographic information, but let's say, I don't want to send encounter. So I'm going to clear that. Let's send allergies. And I don't want diagnosis here. So I'm going to clear that. So if I do that, then I can do another preview and see what that looks like. You can see now we went down from 7 to 6 pages. So it's got, the demographic allergy information here. Oh, nothing kind of, so there's a lab. So there's a lab. And there's a lot of lab. That's why the pages are so long. So there. So you can see what you're sending, and then you can come back here and actually put on here a message to Jeanette, whatever you want, and then just press send. It's just like sending an email. It's a great feature. I think it's one of the most underutilized tool that we have in healthcare that not a lot of people are using, but could be very helpful. All right. Any questions on the access that you get in the portal?
I'm going to sound a little stupid here, but just want to make sure. What about if two pharmacists are working on one of my projects, let's say, and they want to share information, protected health information, they could use this system, and I think they could use what you just showed, something like that, right?
Absolutely.
Okay. Okay, yeah. Good. Thank you.
Not a problem. And I'll share one more thing. So we do have patients that have the option. I mean, patients in the Montana have the option to opt out of participation, which means that their data is shared by their providers, but it's put behind the glass. So it's protected, and only time that you will be able to view that is if you had an emergency situation, and that's per HIPAA regulations. So in order to access that, let's say you search for a patient and nothing comes up because that patient has opted out and you can't access it. So in order to access that in an emergency situation, a provider could go in there and just click on this override function, and they would have to put in here, you know, a reason why they're doing this, and then whether they have verbal, written consent, or if it's an emergency situation, and then they would search, and then that would break the glass and you would be able to view that patient's information. So it's kind of the last feature I want to share with you. And we also have a very robust system to deal with sensitive data. So if facilities are 42 CFR Part 2 facilities and they have sensitive data, there's ways for us to protect all of that information. Only the people with the right consent policy and the role to access that information will be able to override that and get access to that. So it's a really neat little system. So any questions, anything else on the portal? Let's start sharing go back to our presentation here. So let's talk a little bit about the onboarding process in case you want to join the network and get access to the HIE. So if you are interested, all we require is for you to complete our participation agreement and BAA that's attached to that. This was a lot of work for our board of directors, and they also had a committee, a large, great big group of stakeholders that worked on this, try to capture the comprehensive needs and requirements of all Montana organizations. So we can't accept addendums to the PA because it needs to be equal to all participants, but we would share that with you. And we also share our operating policies as they're referenced in the PA. Once you sign up to join the network, we can provide access to the system anytime you want. It takes hardly any effort. All you have to do is fill out an authorized user agreement for the pharmacists or users that you want to have access to the system, consistent with your policy for accessing PHI. And each user would fill out the form, sign it, send it to me, and then I send that off to our help desk, who will provide you with an email with the login and the password information. We also provide training, which is all done through Zoom. It takes about an hour to hour and a half with our trainer. And we offer 3 different times throughout the week. And if none of those times work for you, we'll work with you in setting up a special one for your facility. And as you sign the demo, the direct secure messaging account is also available for anybody that signs up for the HIE. So you would just check that on the AUA form that you fill out, and you would just need to go through the step to activate your account, and you would have access to that just like you saw in the portal. I think we already kind of talked about this because we had a question earlier about the data contribution, but yeah, if you sign on and you happen to want to contribute data, it's pretty simple. I put you in contact with our contacts at Dr. First, and they have literally just a consent form that you would sign to release that you want to contribute data through their connection with your pharmacy software vendor. Now, if you have a vendor that doesn't have a relationship already with Dr. First, and Dr. First will try to work with them and to see if it's something that they can get set up as well. So pretty easy onboarding process. So we'll open it up for questions.
I've already asked a bunch, and so I don't want to ask any more, but this is very interesting.
Oh. Yeah, we're really excited. You know, Montana was the last two states standing without an HIE, and now we won't be the last one because we have this up and running. It's a really exciting endeavor, and I think it's really going to change how we practice medicine in the state, and it's really for the benefit of all of our patients in the state, and make lives of our providers a lot easier. So I think it can be a very valuable tool for pharmacists in the state of Montana.
Mm-hmm.
This is Luke. I don't have any questions, but thank you for all the information and your expertise. This was helpful.
Oh, okay, absolutely. Thanks for joining us. And thank you, Dominique, for telling us about your first experience with the HIE and providing a great use case.
Yes, it was awesome.
Yeah, thank you.
You're welcome.
All right, well, thanks for your time today. Here's my contact information. If you want to contact me, if you have any additional questions that come up, I'd be happy to answer questions for you or provide further information. So I appreciate your time today and wish you guys a happy afternoon.
Thank you very much for this.
All righty. Have a great afternoon.
Thank you.
Bye.
Thank you, Ayan.
Thank you so much, Dee Dee.